As the International Drug Awareness Day on the 26th of June falls on the last week of Youth Month, organizations such as the South African National Council on Alcoholism and Drug Dependence have declared the 24th to the 28th of June as Drug Awareness Week. Well, joining us to discuss most of this and the issues that are affecting the youth in particular is Thokozani Khoza from an organization called Ke Moja, I'm Fine with Drugs. Now, he is a former user. He's based in Ekurhuleni in Gauteng. And our second guest is Thilivhali Livhadi. He is Love Life's Provincial Manager, and he's responsible for programs and organizations, and also is joining us online. Good to have both of you. Thank you very, very much for your time.
Good morning, Leon, and good morning to our viewers.
So, Tilly, let me begin with you. How big is the problem in South Africa?
Well, we look at it from the premise that as Love Life, we advocate for youth health promotion amongst young people, and we also advocate that young people should love life. They should love themselves, and they should be taking care of their body so that their bodies will take good care of them when they grow old. So the problem is alarming in the country because we are observing when we are doing our implementation that in rural areas with the absence of sports facilities and recreational facilities, we find young people converging in corners. In urban areas, we have facilities, but they are underutilized. But we have young people converging at those facilities, but not activating them, but instead undertaking the use of alcohol and substance abuse. We have, according to the statistic, the National Youth Risk Behavioral Survey, indicating that between grade 8 to grade 11, at least 50% of young people have tasted alcohol, and amongst them, 13% of young people have indulged in substance abuse and also cannabis. So the problem is use, Elian.
Yeah, it really is. And it just seems that those ages get younger and younger where we find the youth are taking and trying and experimenting. Thokozani, thank you again for joining us, because I know you were telling us you're not feeling so well. You're sort of getting those flu symptoms, which we're all struggling with through this winter, but it's good to have you. I think you're a very important voice in this conversation because, you know, you have been down this road, and you are what I imagine you like to call yourself a recovering addict. How did you get involved in the scene of taking drugs and becoming an addict? When did it start for you?
All right, cool. I'd like to greet everybody. So good morning to everyone out there. So obviously, as you've mentioned that I'm not feeling lekker, but it's fine. Not even flu itself could stop me from having this interview. So it all began when, let me look back at it. It all began when I started working as a medic. So I used to work for Netcare 911. And then obviously as time went by, I was straight out of school. And then fortunately enough, when I got to the first interview at Netcare, I was appointed as a medic. Right, fast track everything. And then it happened that we had a scene of which it started by trauma, because now you'll understand that people abuse substances for different reasons. But for me particular, it was trauma. So we got to a scene at a place called Crystal Park, where we found a child. I think it was, if my memory still serves me well, I think it was a child in between 1 year, 6 months that was beaten by a pit bull. So I couldn't handle that trauma at that time. And then obviously when I got to the base, my colleague, he resigned like on the spot immediately. So knowing my family background, you know, as Black people, we've got that mentality that I'm going to persist and then I'm going to enjoy and stuff like that. But now here comes the trouble now, or the problem, if you like. I used to struggle with sleep. I started having insomnia, so I couldn't sleep at all. And then obviously I went to one of my friends and then I asked for advice, and then I explained to him everything, that I wasn't sleeping at all now. Wrong decision, but it's only now that I realized that it was a wrong decision. And then he introduced rather he introduced me to my DOC was Nyaupe. So I'm proudly saying that I've got no shame on saying that I was smoking Nyaupe.
Yeah.
So he introduced me to Nyaupe, of which I wanted to sleep at that particular time. That was my intention. So I used to sleep like a baby when I was high on Nyaupe. But now, before I knew it, my whole life started resolving around substance abuse, meaning I used to wake up thinking about drugs. Even during the day, it's all about drugs. And then now, having to sleep, you have to put yourself to sleep using what? Substance abuse. So it all started back then as a medic. So here's the thing that South Africa, even everyone out there, is something that we need to understand. People abuse drugs for different reasons. So for one, it can be trauma. Another one, maybe it's boredom. And maybe it's insecure. That person, they don't have confidence in themselves. Hence why they resort to substance abuse. So we need to look at different perspectives, not only just on one view only. People abuse drugs for.
And Thokozani, I mean, the story that you're telling us, it's quite incredible actually, because you don't necessarily think about that as a reason why you would turn to something like Nyaupe to sleep, because you're struggling, you're going through things, and being in that sort of paramedic role and seeing the things that you do and having to deal and cope with it, and there's not enough support and people don't understand how hard it is, and then you turn to things that literally ruin your lives, and at the time you don't, as you mentioned, you don't realize what you're actually doing. Thokozani, just a quick question to you. I mean, how freely available is it? I mean, could you go anywhere and get Nyaupe? Was it difficult for you, or was it just on the corner wherever you were, you could find it?
Well, it wasn't that difficult. Remember, at first when you're studying with drugs, you come across a person, then they're going to offer you Nyaupe whatsoever. But now, as time goes by, you're no longer going to that person. Like, you literally go to they call them landlords. We call them Sneyman with our Kasilingo. So now you're no longer going to that person who offered you. You're now literally knocking at the door of that person who's selling Nyaupe. So Nyaupe is widely available. You know why? Because at the end, remember with Nyaupe, there are chemicals with Nyaupe. So now when they sell it in our locations, it becomes cheaper. But when they buy it in bulk, it's expensive. Hence why you'll find Nyaupe. Each and every province you go there, you can mention your Limpopo, your Gauteng, your Durban, and so forth. It's because there are chemicals that have been put in Nyaupe, and then it becomes cheaper. Hence why it's all over all of our 9 provinces.
So it is just so freely available. I mean, I'm going to come back to you,
Yes.
Thokozani, to get more of your story. But Tilly, this is the reality, and I again bring Thokozani's story into this because, the role of those around us is so important, and perhaps we don't realize that. Whether it's your family that look on and say something's not right, your friends, the community, the school that you're in, or work, because at the end of the day, I mean, listening to Thokozani's story is that, he was struggling with what was happening and what he was seeing at work, and yet there was no one to turn to. So he helped himself, but it was the wrong way to go. How important are communities to interact, well, not to interact, to get involved when they see things going wrong?
Yeah, it's so sad because from Thokozani's issue, you read a lot of employee wellness programs, whether they have them in his industry or in general in this kind of industry where they know they're exposed to trauma. But from community base, our African philosophy of Ubuntu, it's not being practiced because we need to start by neighborhood watch. Do I know my neighbor's children? Do I understand them? Do I greet them? Are we greeting each other? Because it emanates from here, knowing how we are doing. How are you doing? Or even observing. We see many young people on our street. We see them not going to school. We see them converging. But as community, as neighbor, we are not talking about it. And when we go to community structures, they are not going out to approach young people or to make people aware that you can talk to me. you can talk to a counselor, you can talk to a pastor, you can talk to this structure. So I think people are sitting waiting for victims or to be victims approaching them. So from this story, you can realize that we need to approach people where they are as communities, as neighbors, and as structures than to wait for them to come to us. We can't solve it if we wait for them to come to us.
That is so true. Thokozani, your stories like yours are, they're difficult to listen to, but at the end of the day, you are a living example, because we speak about victims and so many people die from addiction, overdosing, doing things that, they just want to take the pain away. How did you get over it? I mean, you've now been clean, from what I've been told from producers, for 2 years and 6 months. Is that correct?
Yeah, it's actually 3 years, 6 months now.
3 years. Okay. I applaud you, and if I could stand up, I would. I'm so proud of you. But where was the turning point for you? Firstly, how long did you use for? And then when did you realize, oh man, I've got to stop this, and how hard was it to stop?
All right, so everyone, they have their own vision of, in terms of, your downfall. Everyone have their version of their downfall. So when the pain hit the floor, that's when I realized. And remember, like I've mentioned, I used to work as a paramedic, but I had to resign due to my addiction, because I knew eventually I was going to kill somebody if I hadn't resigned from my job. Because now I was every now and then I used to be agitated. I used to have short temper towards the patient and stuff like that. So I took a decision to resign, because I could foresee where I was going with this substance abuse. Obviously, as I'm mentioning, I was going to kill somebody and stuff like that. So that was my turning point. And then after I've resigned, I got my package and everything. But here's the thing, I was under active addiction by that time,
Yeah.
I was under active addiction by that time. So when I resigned, I got my package, and then obviously I blew it all in terms of substance abuse. And then now, as time went by, I could no longer, how can I put this? I could no longer sustain my fix. So I had to resort to crime. And then, unfortunately, I did what we call housebreaking. And then first offender, I was arrested. So I was sentenced to 8 years in prison. And then I stayed 4 years, and then due to parole, I came out. So when I came out from prison, that's where, I started, because now I was coming to my senses, and then I changed the friends that I used to hang out with. And then fortunately enough, I was admitted to rehab, but I went via SANCA, hence why now I'm with SANCA, as you've mentioned, South African National Alcohol and Drug and Alcohol Abuse. So I went with SANCA, and then I stayed at rehab, and then I came out. So I used to, Leon, you know what, with substance abuse, you do something for the very same thing, maybe for 365 days, but expecting different results. So that thing on its own, it's kind of like insane. How can I put this? How can you drink poison and then you expect somebody else to die? Where, by the way, you are the one who's drinking the poison. So that was my turning point, because now, obviously, you first lose your dignity. Your parents no longer trust you. So now I've worked a lot for people to kind of like trust me, especially my parents, and then obviously the community as well. And then I've worked so hard, like immensely. So hardly, and so that was my turning point. Like I was like, no, I've had enough. I've had enough of substance abuse.
Enough is enough.
It's
from a qualified paramedic to indeed. I'm going to have to interact. I just want to come and visit you and talk to you and get all of this information out, because people can learn so much from you, and we really are proud of you for turning things around. Honestly, Thokozani, it's incredible. Tidi, I have to wrap the interview, but perhaps you can just give us a website address or something, if someone's watching this, to say, I need to stop, I need to change my life. How do they go about it? Give us information.
Yeah, we encourage the public, everybody, to send us a please call me We have our psychosocial contact center. They can just send us a please call me to 083 323 1023.
Okay.
083 323 1023. And our trained counselors will call them back. And then otherwise they can follow us on our social media platforms.
Okay, 083-323-1023, that's the number, I've got it in my phone. So both of you, thank you. Thank you for talking about this important issue. And I'm sorry we are out of time, so we've got to wrap it there. But wow, Sakina, what a story.
Indeed,
And
indeed.
I'm so grateful Thokozani could speak to us because I know he wasn't feeling well, but he did such a great job.
So we wish him well, and of course you have the information to get in touch.